Hello, I am Dr. Teena Thomas, obstetrician and gynecologist, Bangalore. Basically, HIV may be present in any body fluid, but the transmission through saliva, tears and all, there is no documentation that it has ever transferred like that, because the HIV is very sensitive virus and do not live in a temperature where it cannot adjust for even more than 30 seconds. So and it is there, as I told you, there is no documentation of a transfer through saliva or a person spitting. The basic thing is, if a HIV infected person spits on other person and the saliva falls into the eyes, there is no documentation transfer of an HIV virus in that way. So even if a blood spits into the eye, there is very minimal chance of transmission. So basically this has not a major indication and no problem of transfer. Has to be checked up. So if there is anything like that and a doubt, you have to go to a local physician and ask for what has to be followed up and what has to be done, but unlikely to be a mode of transfer. Now, non-sexual route of transfer of HIV virus, most important and most worrisome is blood transfusion. So blood transfusion of an infected HIV person, specifically they are all tested and all, but there is something called a window period when the HIV may not have come positive and would have come positive just after that. So if the blood transfusion happens in the window period, or that or there is a especially in drug addicts and all that, there is use of common needles. So common needles are used to prick for injections and drugs and all that. That is one mode of transmission. So these are the other modes of non-sexual transmission, when or abnormal sexual behavior, multiple sex partners. But these are all sexual. The non-sexual is blood transfusion, abnormal pricks with a used needle. That is all.